You alluded to this earlier when you were talking about how apps were maybe previously developed in individual departments. But in my experience at another academic center, we had a similar issue where there was some independent app development that would occur, and we'd have these legacy apps, and then the physician or whoever made the app would leave the organization, and then all of a sudden you had to pick up this
Mhm.
code that nobody knew about and try to maintain it over time. How is your group looking at making sure that they can maintain and keep up with these apps once they're out there?
Yeah. Oh man, gosh. We had the answer to that. I think we would be all set. We wouldn't need to look outside for any vendor softwares. I think we had a similar experience to that, and I'm sure we're very much not alone in some of our applications being written by specialists with really deep domain knowledge in certain things that necessarily weren't easily fungible skill set. And I think somewhat fortunately, I think a lot of people are working in this space, and the a lot of the different vendors and companies globally. So sometimes we have fortunately been in a situation where something starts to not work so much, and it's we're at the point where it's harder to keep putting patchwork onto an application when everything else around it is evolving rapidly. And at some point, with advocacy efforts or more research, and I think publicity around the importance of some of the different functionality in the electronic health record, particularly in pediatric needs, different vendors are catching up and able to provide some of that software. So we don't necessarily need to then go to redesign those applications from the ground up. And there seem to be ways that we can more seamlessly integrate that either from a vendor or a company that works very closely with some of the vendors that we work with.